National Coalition of 100 Black Women's West Palm Beach chapter, Community Health Education Talks. We would like to take the opportunity with this program to highlight health issues in our community. Welcome to our January Health Spot. My name is Charlotte Leonard. I am a member of the National Coalition of 100 Black Women. National Coalition advocates on behalf of Black women and girls to promote leadership development, gender equity in the areas of health, education, and economic empowerment. The Health Spot platform was set up and developed to help educate and provide medical resources on topics that affect both women and girls in our community. I am the chair and the co-chair for the Health Committee for NCBW. And tonight I'm going to pass the mic to my co-chair, Mrs. Sabrina Cooper, who will introduce our guest for this evening. This month's topic is glaucoma awareness. Sabrina.
Good evening, Facebook family and friends. Tonight we have the honor in having with us is Dr. Catherine Lowe. Dr. Lowe is a board-certified comprehensive ophthalmologist here in South Florida for more than 4 decades. Throughout her professional career, she's been a high achiever, a positive role model, along with demonstrating a strong commitment to community services. Dr. Lowe has diligently provided a helping hand to alleviate pain and suffering or put a twinkle in many eyes. As a healer and healthcare provider, she is homegrown and committed to her community. A longtime member and officer of the T. Leroy Jefferson Medical Society of Palm Beach County, National Coalition of 100 Black Women, West Palm Beach chapter. Actively involved with the organizations for many years. She has chaired the organization's health education initiative, recruited fellow physicians to lecture at the annual NCBW baby shower, and has received the Onyx Award. Dr. Lowe's motto is live, learn, pass it on, and have fun along the way. Dr. Lowe is often reminded of the importance of being vertically aligned in the universe. God, family, and business are the essential ingredients for a happy, healthy, balanced, and successful life. Facebook family and friends, let's welcome Dr. Catherine Lowe. Good evening, Dr. Lowe.
Good evening. How's everyone?
You're great. Thank you.
Doing great.
So tonight, Doctor, we're going to be talking, you're going to tell us a little bit about the glaucoma. And before we get started, there's one question we just want to know, and we could go from there. Tell us, what is glaucoma?
You know, glaucoma is really an elevated pressure in the eye. You don't have very many symptoms, but the bad thing about it is it strangles and it kills the optic nerve. Most people have no symptoms from it. It usually runs in families. And especially because there's no symptoms, we call it the thief in the night, because most people have no symptoms. They don't know that anything is going on. They might say, oh, I've got a little headache, you know, my eyes burn a little bit, but that could be a lot of other things. So people really need to know their family history. If there are other people in their family, primary open angle glaucoma is the most common glaucoma.
You have a PowerPoint that we have tonight, so I'm going to go ahead on and start the PowerPoint for you so we can let you walk us through it, okay?
Okay, that sounds great. As I said earlier, primary open angle glaucoma is the most common glaucoma. There's narrow angle glaucoma and there's some other secondary glaucomas that people get. But the most common glaucoma is primary open angle glaucoma. So that is the one that most people need to be concerned about because they have no symptoms. And most of the time people say, I see very well. I don't have any problems. I passed my driver's test. So why do I need to be getting my eyes checked? But it's very important that people have, especially if they have a family history of diabetes, high blood pressure, high cholesterol, arthritis, those kinds of things, they have a little bit more of a tendency to have glaucoma. I think my next slide, if we go to the next one, if we can go to it, it just basically, most of the time when we give talks, we're supposed to have basically a disclaimer. And I have no relationship with any of the drug companies or anything like that. So I believe I can be unbiased in my talk. I won't push one drug or drop more than the other. All right. In the world, glaucoma is the third leading cause of blindness. There are over 13 million people, probably far more than that, people who have glaucoma. Probably 5 million of those have been it's been so advanced that they have blindness from it. So it's very, very important that people get checked. 3 things that you really need to think about in trying to save your sight. African Americans, we are in our community, brown and Black communities, we are far more risk of getting glaucoma, and we get it much younger. And you have to know, that there are not a lot of signs to it until you've had far advanced glaucoma. So early detection is extremely important. To have a comprehensive eye exam. Sometimes you go just to get a quick check for glasses or contacts. Sometimes you go see the optometrist or whatever just for your glasses. Sometimes they will do a glaucoma screening, but you don't get a full, complete exam to check for glaucoma. Some of the things that you wind up seeing when you get the full exam, you get a visual fields. We're looking at your optic nerve, your disc, your cup. People talking about, what is that cup disc ratio? What are visual fields? The other thing that we do is we measure the thickness of your cornea. For some reason or other, African Americans have very, very thin corneas. We're less likely to get macular edema. Our counterparts in whites to get the back part of the eye, the macular edema more. We get the glaucoma because our corneas are thin, our optic discs are more susceptible to lower pressures. So it's very, very important that you get visual fields, your nerve fiber analysis, and all of those testing done to look at your optic nerves, the back part of the eye, okay? If we go to I think we talked a little bit basically about when you have the pressure check. Some people say they don't like that little blue light. A lot of people don't like that puff of air. The puff of air is really a screening test. Again, it's not very accurate. But the applinator, the little blue light that comes very close to the eye and touch the eye, we have to put a drop in the eye to numb your eye. That's to take your pressure, the applanation for your intraocular pressure. We examine the optic nerve and we do your peripheral or your side vision, the perimeter or visual field test. Very, very important that you get that, and a nerve fiber analysis, okay? And your corneal pachymetry. When we talk about pretty much the prevalence, it's very high in African Americans, and we really see that more commonly, especially younger people. I have people in their teens and their 20s who've had far advanced glaucoma and didn't know anything about it. Most of the time they tell you by the time you're 40 or 50, you should get a glaucoma screening. In the African-American community, a lot of times it's when you're in your 20s, especially if you have a family history of it. Next slide. That basically talks about it again. I think there were some studies that and they basically talk about people from the Caribbeans and all, but people who are African-American from the African-American diaspora, much greater chances of having glaucoma and having it early and when they're young, okay? So that's very, very important that people get checked. That we can't emphasize enough. The prognosis, the prognosis when glaucoma is caught early is very good. The prognosis is usually not very good when it's far advanced because we can't bring your optic nerve back when it's been lost, okay? Next slide. There are several other studies that were basically done that talks about the prevalence of glaucoma. And when you see that, it's all over the world, but there are just certain regions sometimes for some reason or other, we don't know if it's industrial or environmental, but most of the time it's genetics, all right? They just talk about the different areas. This is an interesting slide, and it's good to see a picture when you can see what's going on. With the fluid that's made inside the eye, it's made in the ciliary body, it comes around the blue or the brown part of the eye, the iris, comes back around, filters out of the trabecular meshwork. For some reason or other, probably because there's a little bit more pigment in our bodies, it's harder for the the trabecular meshwork and the angle to allow fluid to drain out of the eye. So sometimes people say, well, I didn't just use drops. I had to have a laser, surgery, things like that to open up their trabecular meshwork. Very, very important in glaucoma. This is what happens now when someone has angle closure glaucoma. When the angle closes off, they get pain. They see halos around the lights, things like that. We really see more angle closure glaucoma happening in older people and the people who are of Asian descent. But angle closure glaucoma does happen, but far less common than open angle glaucoma. Next slide. Yeah, that's just, again, showing you the normal flow of the aqueous fluid. Fluid builds up, it comes out of the ciliary body, comes around to the Slim's canal and trabecular meshwork, the iris, the blue or the brown part of the eye. The lens, what becomes a cataract, starts to get larger as we get older. That crowds off the angle. So when there's changes in the angle, then people can have problems with pressure buildup. Next slide. We do a little 3-mirror lens called gonioscopy, where we take a lens, we put in to bend the light so we can look down in the angle where fluid is draining out of the eye, well or not well, and we look at how open the angle is. All right. So there's several tests that we do. And when there's collapse of the angle, and especially with angle closure glaucoma, people usually have pain and they have halos around lights. And that's what people think about. That's 3 to 4% of glaucomas, okay? 95% of glaucoma is open angle glaucoma. Those are just some of the things of what's happening when they're talking about the cellular death, the ganglions, those are the nerves. The optic nerve is the cable that sends messages back to your brain to tell you what you're seeing. When we destroy the optic nerve, central nerve, it's very difficult, almost impossible for us to bring that back. That's why glaucoma needs to be caught early, all right? And they're just talking about the genetics. If your grandmother, if your mom, if your dad, aunts, uncles have glaucoma, and a lot of times people don't talk about it a lot, and you see them putting drops in their eyes all of the time, you almost need to know or ask the question, is there glaucoma in the family? Okay. And just some of the things that we see, the classical risk, when there's a strong association in family members, if you have high pressures in your eyes, if you're African American, if you have a family history of it, sometimes even if you're very nearsighted, if you're diabetic, if you got arthritis, high blood pressure, those kinds of things, systemic hypertension, those are risk factors that increase your chance of developing glaucoma. Next slide. Some people even talk about migraine headaches and other things that are happening. There's another thing, and at the bottom of the slide, if you see this, low tension glaucoma, where their pressures aren't really high, sleep apnea. Sleep apnea, and a lot of people have problems with, they have snoring problems, they have big barrel chest, they don't breathe well, and if they have sleep apnea, we can see low tension glaucoma. That's another glaucoma that can get missed a lot of times. So that's important that we get diagnosed with our sleep apnea and learn to get our CPAPs and the things that we need to do so that we're breathing. Because we just know that what happens is the circulation, not enough oxygen is being perfused to the optic nerve, and it can cause problems. So that happens in sleep apnea when people are sleeping and snoring and not getting enough oxygen to their brains and their nerve. Okay. If you leave that slide there, if you can see it, it's not probably a great slide. There's the blood vessels, that's the optic nerve. In the center of that disc or nerve is what we call cupping, where it looks like it's been excavated. That's when nerve cells are being lost. And we look at the cup disc ratio. People say, what are they talking about? I got big cups. Nearsighted people can have big cups, or myopic people, but we also see loss of ganglion cells in the optic nerve with glaucoma. Next slide. Oh, I put that slide in there. I went to Yellowstone and saw Old Faithful go off a long time ago. So I always just like to put nice pictures in, because some people say they get nervous about seeing eye pictures. This is what I'm talking about earlier, the disc cup ratio. You can see a normal disc and the blood vessels, the optic nerve and the veins. The picture on the right is a little cloudy, but if you see the cupping of the disc on the picture on the right, It looks excavated, like you take an ice cream cone and you just scooped it out, but that cup is much deeper, if you can see that. That's what we get concerned about when we start telling people they've got big cups, and we have to watch that. All right. Some of the other things that we look for, again, you can see in a glaucoma, when you look at the backgrounds of people's eyes, you can see different, because of shading and pigmentation in their eyes, you see this, but you can see the cupping. And we look at blood vessels, we see hemorrhages on the disc and all, we get very concerned about that. Next slide. Yeah, this is somebody who's just very nearsighted, and they got some of the other changes, but they've got big, big, big cups. So it looks like it starts looking whitish, like it's not nice and pink, like they're not getting a lot of blood vessels supplied to it, but that's disc cupping. Next slide. So it's really, really important. We see some other things that you can see with big cups, and we watch out for those. People being nearsighted, they have some other things going on with their sclera and the back of their eyes, but the main thing that we look out for cupping is for glaucoma. Next slide. So if you get a hemorrhage on your disc, that's usually a poor prognosis for glaucoma. It usually means you haven't been using your drops. The normal pressure we usually like to see, the reading for the intraocular pressure, it's usually between 10 and 22. A lot of times in African Americans, we like to see it a little bit lower because, as I said, because we have thin corneas, that's the window where you would wear a contact lens. Corneas are usually thinner in African Americans, so they can't really tolerate higher pressures. But normally they usually say the pressure is between 10 and 22. We like for the pressure to be 14, 15, 16. All right. There's if you can see on the right, for the right eye down, inferior down almost at 6 o'clock, you see the disc hemorrhage that's there. That's usually a poor sign that there's been ischemia, not enough oxygen to the disc. That's usually a disc that's being attacked because of high pressure. Okay, not a good sign. You don't like to see those. There's normal tension glaucoma and even the low tension glaucoma that we talked about, especially with sleep apnea, but normal tension glaucoma far more common in females. We see it happen, some other neurological entities that take place, but those are other forms of glaucoma, but it's usually the primary open angle glaucoma that we're most concerned about. The one thing was that it's sometimes when there's normal tension glaucoma, we have to be sure that there's not a tumor somewhere in the brain compressing the optic nerve. Okay, next slide. Migraine headaches, those kinds of things, poor circulation, low blood pressure, poor perfusion to the optic nerve. Those are some of the things that we wind up seeing. Next slide. Some of the medications, how do we treat glaucoma? There's several ways that we treat glaucoma. There's usually a class of drugs, usually eye drops. They constrict your pupil, they're beta blockers. The beta blockers, the most common one is timolol or Timoptic. It's a yellow top, you use it twice a day. The one thing about beta blockers are also used for high blood pressure, for pranolol, those, it can slow the heart rate. So a lot of times we have people to watch out that they don't get faint, they don't get dizzy. There's carbonic anhydrase inhibitors, dorzolamide, Diamox, the prostaglandins, timolol, the ones that you use once at night, Travatan, Lumagan, latanoprost. The alpha agonists are the bromonidine. Those we give a lot of times when people can't tolerate the beta blockers, the timolol, the yellow top, because it will slow their heart rate. They usually will do, alphagan or bromonidine. Then there's surgery. Sometimes, and some people are now, the literature and the academicians are starting to say we probably, when we make the diagnosis of glaucoma, should offer laser treatment for people early on. Because if we look at the economics of it, if this is a chronic illness, it's not going away right away. So if you're going to calculate that you'll have this for the next 30 or 40 years and what it cost you for your drops, you might be better off to have had a selected or argon laser trabeculectomy. Sometimes you have to use less drops after that. There's cryo, there's filtering procedure, trabeculectomies, iridectomies, but those are usually the surgical procedures that are done. Next slide. as I said, those are some of the drops: the timolol, the bromonidine or alphagan, the latanoprost, pilocarpine. So those are some of the drops. People will usually say they don't remember those big names. They just said, I know the color of my top. It's turquoise, so it's orange or it's yellow. So, and if you see people, drops have to be used religiously. You cannot miss your drops. And compliance is always something that's very difficult. People get busy, don't want to brush my teeth. I don't want to floss my teeth. I forgot to put my drops in. I didn't take my blood pressure medicines. You know, those things come up at times, but it's very, very important. Your sight, we can't bring it back. And your of the five senses, people usually say, okay, I can lose my hearing. I can lose this. I can lose my sense of taste. I don't want to lose my eyesight. So that's very, very important that we keep our eyesight. And that's just showing an argon or SLT or an ALT. We put the laser there, we treat down in the angle. We sometimes make a little hole in the iris. We sometimes make a new little pathway for the fluid to drain out of the eye. There's someone with a filtering bleb after they've had cataract surgery. There's shunts, little tiny tubes that are placed inside the eye. But those are things that we wind up doing. And that was another, that lady is Alice Walton. I'd gone to the Crystal Bridges Museum in Bentonville, Arkansas, the home of Walmart and Sam's. And we were there for an art show. So very, very important that people get their eyes, their pressures checked, their visual fields done, their nerve fibers checked, those kinds of things. And make sure that you check with family members, because if there's a family history of glaucoma, you need to be watching out for that and paying attention. All right. And I believe that should be most of my slides. I don't know if anyone has any questions or, there's some other things that we see. An entity called pseudoexfoliation syndrome. Those little flakes flake off and fall into the trabecular meshwork, plugs off the angle, and of course causes the pressures to go up. So if somebody has pseudoexfoliation, we get concerned when they're having their cataract surgery and they make sure that they don't have a secondary glaucoma. Now I think that's pretty much in another language, that's pseudoexfoliation. Now this is an intermittent angle closure. This is when there's narrow angle and the angle keeps closing off and people start having pain, corneal edema, swelling, and saying, I see halos around lights. That's angle closure glaucoma. All right. That's an episode where someone has had surgery. They got a hyphema blood down there. They've had a peripheral iridectomy for making a new passageway for the fluid to drain out of the eye. That hyphema down at the bottom, that wasn't good. There's some other things. The pigment dispersion syndrome, when pigment falls down into the angle, makes it harder for the fluid to drain out of the eye. So that's very, very important. Sometimes they need a laser for that. Other interesting parts of the eye where you're just seeing the back of the eye and things down in the angle where they're treated. Anterior segment dysgenesis, we see this a lot of times. Believe it or not, we see this in sickle cell disease. Sickle cell disease causing the problems in iris atrophy. So that's another entity that we wind up seeing. And those are people who we also need to be looking for possibility of glaucoma. All right. And thank you.
Okay, thank you so much, Dr. Lowe, for taking the time out tonight. But one quick question that I do have is,
Okay.
how can uninsured or underinsured get treatment?
That's a very good question. It's in here in Palm Beach County, we have something called Project Access through the Palm Beach County Medical Society. And a lot of times when people are underinsured or don't have any insurance, they can call the Palm Beach County Medical Society through Project Access. Some of the health clinics, people go to the health clinic. There are a couple of other, the Caridad Center, mainly for a lot of immigrants and all. But usually people, it's very, very important. And you know, there are a lot of times people at their churches and all, they have screening events. T. Leroy Jefferson Medical Society, we have a health fair that's put on periodically. But the most important thing I would say is to try to get through healthcare tax district, because we as taxpayers, we pay for healthcare tax district, trying to get people enrolled so that they will be able to get treatment for their diabetes, their chronic illnesses, high blood pressure, and glaucoma. Those are very, very, very important. They are.
Okay. Well, again, thank you so much, Dr. Lowe. At this time, I'm going to turn it back over to Charlotte Leonard for our closing remarks.
Okay.
Well, Dr. Lowe, thank you again for that presentation. I did have a couple of questions. I have, of course, 2 family members with glaucoma. So one question was, how close in the family line should we be aware of that heritage or that?
Usually it's direct line. So it's grandparents, parents, siblings. Sometimes people say, well, my aunt, my uncle had it, but if it's a direct line, if it's your grandparents, if it's your parents, if your siblings, your sisters or your brothers, then that is very, very, very important. The rate is extremely high at that. But even distant relatives, when you might have finding, oh, I have an aunt, I have a, uncle, those are important as well too. But I would say the direct line is most important.
Thank you. And the last question, how often should we get our eyes checked? So I know we normally go for our glasses once a year, but if we have glaucoma in our family, how often should we be going to get our eyes checked just to make sure we're catching it early, if that's possible?
The number we still say is once a year.
Okay.
Once a year. And if everything checks out normal, then you're good. But if they wind up finding something, in other words, thin corneas, large cups, high intraocular pressures, visual field changes, any of those things, if they find something, oh, you know what? We didn't talk about smoking. Let's talk about risk factors. Let's talk about diet. Let's talk about smoking. Let's talk about any of those kinds of things. Eating a good diet, making sure that we're getting all of our vitamins and things, our beta carotene, believe it or not, the beta carotene in carrots, the lutein, all of the good things, our green leafy vegetables, all of those things. We have to learn how to prepare foods that we enjoy, culturally speaking, but it's also healthy for us. So this cutting back, all things in moderation, cutting back on our drinking, no smoking. Smoking is just out. As far as smoking is out. Cigarette smoking, and nobody talked about marijuana or glaucoma, but it's those things, taking care of our health in that sense. It's extremely important, and it really makes a difference. It just does. It makes a big difference.
So I'm going to end this, but it's so funny because I can go on about family members who believe in that marijuana or Marinol for their glaucoma, but I also have families that take drops for so both of those things I'm quite familiar with in the family line. So thank you for that. It was quite enlightening. I really did not realize that sleep apnea had a relationship to glaucoma. So that's also something that's in the family line. So for me tonight, this was very informative. Hopefully the community has learned a lot from you, learned where they can go for resources if they are uninsured or underinsured. But most importantly, they can always come to you for an eye exam should they need that. So where can they find you if they need to come for an eye exam?
My office is at 11380 Prosperity Farms Road, 112C, Palm Beach Gardens, 33410. The phone number is 561-775-1721. I think I do have a little small web page as well too, but I think that most people can usually find me up in Palm Beach Gardens. That's where we are.
All right. Well, thank you again. This was great, and happy or not happy, but Glaucoma Awareness Month. Hopefully we have educated our community and brought some positive and very helpful information to the community about preventive measures and also things they can do to minimize their risk of glaucoma. Thank you again. Have a great evening, and we'll be talking to you soon.
Okay, and thank you. Good evening.
All right. Bye-bye.
Bye-bye.